Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. So for a patient who attended with bilateral fully occluding medial earwax. Bilateral in terms of ears means both ears, and medial means deep in the ear towards the eardrum. What makes this procedure a bit more complex than your norm is that the patient also had very narrow and bendy, twisty ears, and you'll be able to see that once I get the plug of wax, this first plug of wax, you can see the ear bends to the left and then to the right. This is the patient's right ear. If you stay tuned and watch the patient's left ear, you'll see the left ear was even more narrow and more twisty, more bendy. In fact, there's almost a 45-degree bend in the left ear. So we've got the majority of the wax off the tympanic membrane. There's this last layer, and the patient had been using cotton buds. You can just see the eardrum to the left now, it's just revealing itself. I'm using a standard Zollner suction probe, but there's very limited space in there because the ear is so narrow, and there's also wax trapped in the anterior recess. Where we are now, the ear canal narrows and it widens again, and it creates a pocket, a recess, both to the right of the eardrum, which we call the anterior recess, and also to the base of the eardrum, we call that the inferior recess. So I've just now attached a fine end gauge, because it's a narrower suction probe. It allows me access into the anterior recess, and you can see the bends and twists here. Just some soft wet wax near the base. The patient symptoms are alleviated. Just going to mop this up very quickly. Sometimes less is more. We don't want to be in the ear for too long with suction unnecessarily, because suction can be quite noisy. And prolonged exposure can cause what we call a TTS, a temporary threshold shift. So it's a temporary reduction in your hearing. In the worst case scenario, if it's overexposed, it can cause a PTS, a permanent threshold shift. In addition, additional excessive suction, especially when it's close to the eardrum, I would say, can cause the caloric effect. The caloric effect is when the suction probe reduces the ear temperature too much, whereby it inhibits the organ of balance in that particular ear, which leads to a reduction in signals to the brain, which causes your brain thinking that you're moving and you're not, and then you suffer from vertigo, feeling the room spinning around. And your eyes spin, and your eyes try to correct your brain, trying to tell your brain that you're not moving. Just in the left ear, so in this ear, the patient hadn't been using any drops, so the wax is a bit more firmer, it's a bit more stickier. You can tell that the patient has also been using cotton buds, or Q-tips as they're known in America. Well, actually, from what I understand, in America they're called cotton swabs, but there's a brand name called Q-tips, and that brand name has now become synonymous with cotton swabs, a bit like Hoover. So it's called Hoover because of the brand. It's synonymous with vacuum cleaners. Anyway, just using a standard Zollner suction probe, and although this ear is so twisty and bendy, we've mitigated the bend just using the endoscope. I've managed to retract the cartilaginous portion, the posterior canal wall of the lateral cartilaginous portion of the canal, and we've just straightened it, and you'll see the bend in a minute. I just might see the ear, and you'll see, if you keep watching again, you'll see, at the final view, you'll just see how bendy this is. Just some sticky wax, just laterally on the anterior lateral canal wall. So anterior means the front part of the ear canal, lateral means the back. I know some folks don't enjoy me using all the correct anatomical names, but again, this is not purely for entertainment. I know some of you do watch it for entertainment, which is great, but there are some audiologists, junior med students that also watch this, even some GPs or nurses. So you can really appreciate the bend. So the ear canal goes to the right. So this is at the entrance of the ear canal, believe it or not, where we are now, and it bends to the right. I hope you enjoyed that video, guys. Take care and speak soon. Bye.